Hey folks, how you doing today? My name is Rob, and once again, welcome to my website. This video is going to be brief. It's just going to be an overview, of how Part B of Medicare works. And if you watched Part A in the previous page, we talked about how Part A covers your hospital services and went into some detail about what that would entail as far as your Part A and covering your hospitalization services. So, as you may have guessed, Part B mainly covers your doctor services as well as your outpatient services and those type of things, just to kind of keep everything at a broad general overview. But again, there may be some reasons why you may want to delay getting into your Part B premium, or excuse me, enrolling in Part B. Just like, again, in Part A, when you turn 65 or first become eligible for Medicare, they're going to send you your Medicare card right away. Automatically, you're going to be enrolled in Part A. And typically, for the most part, there is not a charge for Part A. Again, as we talked about, as long as you worked at least 40 quarters during your working lifetime, then typically Part A is paid for. However, Part B is a little bit different. Part B actually does have a premium to it. So, again, depending on when you're watching this, whether it's 2016, 2017, or what have you, typically the Part B premium runs roughly anywhere from $130 to $140 for most of the general population. Again, I'm just using a broad overview. Most people are going to be paying that. Now, depending on your income bracket and a lot of other factors, which I can place a link to so that you can look up what you might be paying. Again, most will be paying that 130 to 140. But again, if you're in a higher income bracket, you may be charged a higher amount for your Part B premium. So again, most people though will be paying around that amount. Now, I discussed why you may want to delay. That's if you're in your working years still. Again, most people, years ago, most people retired at 65. Now, most people are working beyond 65, and typically they usually have healthcare coverage that's creditable coverage. They have hospital and doctor coverage, as well as coverage for prescription drugs through their group employer or through their employer, their group health insurance. So again, you may not want to be paying a Part B premium if you already have coverage that's duplicated. So what some people do is they delay their Social Security and they delay their enrollment into Part B, which makes sense. So again, though, once you retire and you lose that creditable coverage, you want to make sure that you enroll in Part B right away, because you could get a Part B penalty if you don't. So again, I'll provide a phone number where you can call 1-800 and get to Medicare and make sure you enroll in that Part B if you've decided to delay. But in any event, as I mentioned, Part B has the premium. There also is a deductible, just like there was with Part A. Part B, right now, it's typically $183, and you would pay that once per year. So again, the first any eligible or covered services, the first of the year, whenever you go see, when you utilize those that service, you're going to pay the first part, which is $183. And I'm going to read the definition to you right off of Medicare.gov. It says Part B covers two types of services: medically necessary services. Services or supplies that are needed to diagnose or treat your medical condition and that need accepted standards of medical practice, and also preventive services, healthcare to prevent illnesses like the flu or detect it at an early stage when treatment is most likely to work best. And again, you pay nothing for most preventive services if you get the services from a healthcare provider who accepts assignment. So again, if it's your once a year preventive visit, you typically will not, you should not be charge that 183. But anything else, for example, if you were, you had the cold or you had a flu or you weren't feeling well, you schedule a doctor's appointment, you're going to pay that first $183 up front, whatever the doctor is going to charge you, and then it's typically 20% from there. So again, it's that 80-20 relationship we had talked about. So in previous segments. So again, you're going to pay 20% of that bill, which could add up very quickly. And we'll talk about ways that you can circumvent that. I won't get into it in the scope of the video. But again, what does Part B cover? Part B, I'm just going to give you some examples. It covers things like clinical research, ambulance services, durable medical equipment, mental health, both inpatient and outpatient, partial hospitalization, getting a second opinion before surgery, which is very huge, limited outpatient prescription drugs. Typically, again, the drug, most 90% of the drugs that you take out there will be covered under your Part D coverage, which is what we'll talk about later. But again, there's certain circumstances where a doctor may administer a drug inside of his office, and sometimes it's picked up under Part B. And again, those are few and far between, but it does happen. Actually, happening more now than it was before. So again, there's two ways to find out if Medicare covers what you need. And again, this is general. It says talk to your doctor or healthcare provider about why you need these certain services or supplies, and ask if Medicare will cover them. If you need something that's usually covered and your provider thinks Medicare won't cover it in your situation, you have to read and sign a notice saying that you may have to pay for the item, service, or supply. And again, I'm just reading this just from a legal standpoint because I have to. But anyway, generally, if your doctor is participating with Medicare and he says, hey, you need something or you need this treatment, typically it will be covered and picked up by Medicare as long as it's medically necessary, either under your Part A or your Part B. So again, like I said, B is really your doctor services and your outpatient services, whereas A is your hospitalization. And again, just if you scroll down the page, I'll have more examples of exactly what is covered under Part B. But again, I just want to give you a broad overview of what Part B is really all about as far as Medicare. Like I said, some people delay their Part B premiums, and they, while they're working. And again, there's certain coverages. If you decide, hey, you know what, I don't want the responsibility of these deductibles, and I don't want to be responsible for the 20% outlay, you could enroll in a Medicare supplement plan, or you can decide to enroll in a Medicare Advantage plan, or what's known as Part C of Medicare. And again, those rules kind of go out the window, but I don't want to get into that right now. Again, these are just ways that you can help circumvent these premiums and deductibles if you just, if you don't want to have just A and B, which a lot of people don't. So again, A and B does a great job of what it does, but most people, again, don't want to be on the hook for 20% of an outpatient surgery or something like that, because again, that can add up very, very quickly. And that's something where a Medicare supplement plan or a Medicare Advantage plan might be more advantageous depending on your situation. So hopefully that makes sense, folks. And feel free to, jump on over to Part D, or Part C would be the next in line. And that really talks about how Medicare Advantage plans work and why they may be attractive to you. So thanks so much, and look forward to seeing you in the next video. Thanks.